going to show you how to use the Jet Peel skin therapy system. And the first thing to do is to put the unit together and make sure everything works. So it's important to get all the lines hooked up properly. Attach the handpiece to the oxygen line. Make sure that the nozzle is secure and ready to go. Make sure the foot pedal is attached and functional. So we're going to start with the lymphatic drainage massage, and traditionally you would start from the left-hand side. The usual cross-contamination precautions must be taken care of. Wear gloves, wash your hands. If you like to wear a face mask, that's not a problem. You would have checked the patient's medical history and she would have signed the consent form. So we start. You press the foot pedal and make sure that the handpiece is working properly and you can see all the 3 jets coming out. It's very important to make sure that you can see all the 3 jets. Then cover the ears carefully. You want to press on the earlobe in the ear canal. And you start from about 7 to 10 centimeters away from the skin. That is the distance for your lymphatic drainage. And of course, you have to follow the contour of the body. So not that you start with 7 centimeters here and you end up twice the distance when you're down there. Follow the skin through. So here we go. You start from the neck. So you do nice, simple, gentle movements all the way down. And of course, you start at the top and you take your foot off the pedal at the bottom. Start and stop again. Nice and gentle, like brushing. Okay? And then you can do spirals. Check the diagrams for the lymphatic drainage and you will see all the flow parameters there. Then you start from the forehead, come all the way down, and stop. Start from the forehead, come all the way down, following the contour of the body all the time. Then the upper eyes. A good few passes. Obviously, I'm doing it a little bit faster now. So every time I'm doing it just once, you would do it about 3 to 5 times. Then the lower eyes. Now, some patients are a little bit claustrophobic. Some patients don't like around the eyes very much. So what you do with those patients, you just very gently cover the eye and just treat the upper bit. And then cover the upper and treat the lower bit, and that's it. Then don't stress them too much. Then you do what I call the L's, which is you start from here, move to the side and down, and you keep repeating. Off, start, and off. Again, about 3 to 5 passes per treatment. Then we do the other side, again, covering the ear, starting from the neck. Then you can go into your spirals, then the forehead, as before. Okay, so that is the lymphatic drainage. Now, we're going to start with the exfoliation part of the treatment. It would be the forehead first, side of the face, chin, neck, if you wanted to, the décolletage, then the other side, and right at the end, we will come and do the upper lips and nose. That's the last sections we're going to do. You divide the face into sections. Each section is almost as wide as a finger band. So it would be 1, 2, and 3. 1, 2, and 3. Middle of the forehead we'll do last. It's the last section we do. Then side of the face, 1, 2, and 3. Chin. Again, side of the eyes, 1, 2, and 3, and chin. Then we come and do the upper lips and nose. Okay? The distance now changes, and it's only about 0.5 centimeter to 1 centimeter away from the skin. Every patient is different. So you start with the first section and you do exactly as I do, and you wait and you have a conversation with your patient, and that is your patch test. You start, you press your foot pedal away from the skin, come close, and you start. Nice and easy. You make about 4 passes, and that's about the right speed. That is 2. That is 3. And that is 4 passes, and you stop. You ask your patient, how do you feel? How do you feel?
Really good.
Okay. This is as bad as it's going to be. Are you okay with that?
Yeah.
Great. So the reason we had that conversation is that we are just buying about 10-20 seconds worth of time, and this is our patch test. So you're looking at the region of the skin you treated now. If it's a little bit pink, that is what you want it to be. If it's too red and with red lines, maybe you're too close, you're too slow, you want to go a little bit further back, and you need to go a little bit faster. If you've made no change at all, maybe you're too far away and you need to get a little bit closer. So that is your patch test, okay? After that, you start from the second section, again, making 4 passes, and move to the next one. Obviously on the side, the area is a little bit smaller. Like I said, then you repeat it on the other side. Middle of the forehead is less vascular. We'll do this right at the end. It's very important to have the direction of the flow away from the eyes. There are only 2 rules with this system. Rule number 1, never stop. Even if you're thinking where to go next, keep moving your hand. So we've done all that section, we're going to do middle of the forehead. Rule number 2 is that it's always away from the eyes. So the direction of flow here is away from the eyes. Never like that. Never like this, away from the eyes, and never like that. It's always away from the eyes. So there, there, and there. Not like that, never like that, and never like this, okay? We're doing the forehead. You go a little bit faster here, and maybe you can do about 6 or 7 passes there. Then we start on the side of the face, cover the ear well. There are many things you can do. Some people put ear plugs in there, some people put hair bands there. The easiest thing to do is to cover the ear with your finger really well. Don't forget that the direction of flow is away from the eyes, so never like that. And you do about 6 or 7 passes really fast. Just like that. And that is it. And you look for the skin a little bit pink, that is where you want it to be, okay? Then you change your tip direction. You remember, the tip is always lined up for exfoliation with the direction of the hand movement. So you change the orientation and you start on the side of the face. Nice and slow, you make 4 passes in each band. Once you pass the first line, if you're smart with your hand, you don't have to hold the ear anymore, because the direction of the flow is nowhere near the ear. When you get near the eyes, you just angle it away and go faster, and then slow down again. So nice and easy. Slow, 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 fast, 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 and slow down again. Don't touch the skin. Then the next line, again near the eyes, you go fast and slow down. Then it's the turn for the chin. You can probably go from left to right on the first time, and when you do the left hand side, come back and go up and down. So we do it left to right, 4 passes this time. Nice and easy. The skin here is very thick. You're not going to damage it. So very gentle, very slow, 90 degrees almost. That's 4 passes there. And now we start from the left hand side. And start close, really close, only half a centimeter away. Cover the ear well. Okay, now we're going to work on the upper lips and the nose. And some people find it very difficult to breathe. So ask them to do this breath hold exercise. That's the easiest way to handle the situation. So you say to them, breathe, and they should breathe in and hold their breath. And when they do, you do your treatment. And don't forget to give them time to breathe again. Psychologically, it's better if you tap the area you're going to work. So you say, breathe, tap, you work, and stop. Breathe and stop. Breathe and stop. You repeat the whole thing one more time. Breathe. Work really hard on the smoker lines. Breathe. Breathe. Now I'm going to show you something which is very nice, and that is how to treat the lower lip, and it's usually ignored by most practitioners. So you are almost parallel to the face. Start your handpiece, come close. You may get the jet flow into the mouth sometimes until you master this one, but it makes the lips plumped up, quite red, and it's a very nice treatment. Then we work on the side of the nose. Again, it's better to ask them to do the breath hold exercise. So breathe, tap, here we go. You can do a circular motion as long as your distance is close. Again, breathe. Don't come up too much. You don't need to come higher than that, and definitely not have it your direction of flow towards the eye. So it's away from the eye in that area. Breathe, and you repeat the whole thing. So that's the exfoliation done. That section of the treatment should take about 15 minutes again. Before we move to infusion of the actives, we need to dry the skin. So open, take your handpiece off, place it safely in its place. Use the air hose itself, press your foot pedal, and just use the air about 10 centimeters away from the skin, and you're just drying the skin, covering the ear as you go. It's a very nice, pleasant part, and let them enjoy it. Dry the skin there, like that. Nice flow. It will be a nice little massage as well. Okay, so that's that. Now we're going to do the vitamin infusion. You take the other handpiece, which was not attached to the saline, attach it to your air supply. Then you take the plunger and you put whatever solution you're going to use. Right now I'm going to use the glycolic acid solution. You put the plunger in, hold it, make sure your plunger is in the liquid. You press your foot pedal until you have liquid come out the tip. Once it's doing that, then you take the plunger out, and there you have exactly 2 milliliters of liquid in the line, and that is what you're going to use to treat the whole face. Okay, it's the same as before, so it's forehead, side of the face, chin, the other side, upper lips and nose, except that instead of having it in bands, we're going to do the whole sections. The orientation of the tip is the infusion orientation, so the lines of the jet are parallel to the direction of your hand movement. So you start, again, only about half a centimeter to 1 centimeter away from the skin. Once you start working, you can place the tube on the patient, not before, because it leaks out. But once it's working, it starts going through the handpiece and it won't leak. About 2 passes per area to start with. Cover the ear, so we're covering the whole side of the face, nice and easy, away from the eyes. There, we are done. Now the chin, nice and easy, very slow, very close. And then the other side. It helps you if you ask your client to move their head as you do the treatment. Maybe under the eyes you go a little bit faster and then you slow down. Try and not touch the skin. And then when we go to work on the upper lip and nose, as before, you ask them to breathe, tap, start, and off it goes. And now the nose. And stop, breathe. And stop. So we've covered the whole face, and if you look at your line, you probably have about a third of it left. So now you can just concentrate more on the areas you wanted to treat a little bit stronger. So usually middle of the forehead and the upper lip, or whichever area it is that you need to work a bit more around the pores. So just do the treatment, or you can go onto the neck until your liquid is finished. Okay, of course you can do combinations. So right now I used the glycolic acid. Perhaps after that you want to move on to one of the vitamins and repeat the whole pattern and the same thing again. Place the handpiece in its place. Don't forget to flush your handpieces. Check in your manual, and it has detailed descriptions about how to flush the handpiece. It's very important, otherwise your handpieces get blocked and damaged. And then your patient is ready to be discharged, and you need to follow your protocols on discharging. You sit them up, do a little bit of neck massage, get the blood pressure stabilized, and once the patient is happy because they've been lying down for so long, they can come off the bed and carry on. Follow your post-treatment protocols and have a very pleasant therapy.